We've got Dr Arun Karanwal, a specialist medical oncologist at Prime Hospital Dubai on the line. Dr Arun, good morning.
Hi, good morning. How are you?
Thank you for joining us. Now, tell us, what is the state of cancer here in the UAE in 2024?
So, as this study has highlighted, we are expecting to see rising numbers of new cancer cases every year in UAE also. This is matching with the other country statistics and worldwide data from the cancer institutes. So we also expect that new cases will be increasing trend in the next each year. And commonly we see tumors like breast tumors or colon tumors, leukemia, lymphomas, lung cancers as a most common new cancer cases.
One of the things that this research pointed out was the difference between men and women in different ways. Lifestyle factors, particularly it points out smoking. I think it said about 32% of men smoked in a year in 2020 as to 6% of women. Of course, we have a smoking culture here. There are many people here in this part of the world would smoke. How much are these sort of lifestyle differences playing into the increase of cancer rates, do you think?
So currently, whatever number of rising cases are seeing are possibly linked to our lifestyle changes. And one of the important factor in that is tobacco use or the smoking and oral tobacco use in different parts of the world. So in general terms, statistics says that it is linked to 50% of the cases of cancer in the world. So if we cut down the smoking trend, completely stop it in the as much as population, then definitely we can reduce the number of new cases of cancers.
Now, we've been speaking about one other difference, of course, between men and women, and that is that there aren't necessarily the same early prevention or detection testing sort of procedures that happen with such frequency that women might have, say, for cervical cancer or for breast cancer. It's not as common or as frequent for men on cancers like prostate cancer. Is that something that you think reflects the UAE? How prevalent and how routinely are men getting checks early on so that they are detecting things before they, go from bad to worse?
Yeah, so if we see the commonest cancers in the men are lung cancer, colon, and prostatic carcinomas. So currently we have guidelines for screening of prostate carcinoma and lung cancers, particularly for the heavy smokers and also for the colon tumors. However, because of some different reasons or the social nature of the population, men are not too much involved in the screening. Females, currently we can see so many campaigns going on for the breast carcinoma and cervical carcinoma. So I think there's a significant increase in the awareness in the female population about the mammogram and the cervical cancer screening testing. However, in the men, I think that part is still slightly not so much we are not so much focusing on the men cancers. So maybe that is a possible primary reason for not early screening in the male population.
We spoke on the agenda earlier, maybe last month or just a little bit earlier than that. Regular listeners might remember that we were seeing some concern among doctors about breast cancer, even among women, because during the pandemic, people had delayed their screenings. They had delayed appointments because they couldn't get in or it wasn't possible to do so. And of course, we were very occupied in those times of the pandemic, and that may have created a bit of a backlog. So I suppose that is something that you would obviously also be seeing yourself in your practice.
Yeah, definitely. The pandemic has made a significant impact on the regular monitoring or regular screening and diagnosis of the cancer disease at that point of time. And currently, maybe we have come out from that pandemic, and now there is a regular screening and regular follow-up of all the required population is ongoing. But definitely during those 2 years, the things were different, and many people we have diagnosed in the advanced stage, or many people has diagnosed, but they were not able to complete the treatment because of different reasons. So it has impacted many patients at that point of time.
Now, Dr. Arun, the UAE is really determined to reduce cancer mortality by nearly 18% by 2025. That's very soon. That's just around the corner. What do you think? How realistic is a target like that? And what is being done to achieve that?
So definitely the government here and the Ministry of Health is making some very important policies and timelines to try to control the incidence and mortality rate from this important disease. This is in line with the international guidelines also. So if I can highlight the important points which our government or other international guidelines are highlighting are to improve the awareness about cancer, to improve the awareness of the screening for diseases like breast carcinoma, cervical, colon, lung cancers, to try to get a diagnosis in very early stage, which will definitely increase the cure chance and reduce the mortality. Another important aspect is to improve the infrastructure for diagnosis and treatment of such diseases. So there are so many new upcoming comprehensive cancer centers are launched in UAE, including in Dubai, like 2-3 different centers are coming up in the next 1 year, which will give comprehensive care, including all the important treatment options, and the latest advanced treatment will be available in a single roof. So other than that, government has also made some important vaccines like cancer prevention vaccines as a part of universal immunization programs, like hepatitis B and HPV are now included in the childhood immunization programs.
Yeah.
So these are very important steps to try to reduce the further increasing trend of the new cases and ultimately reducing the mortality or the death from such disease.
Yeah, big thanks there to Dr Arun Karanwal. He's a specialist medical oncologist at Prime Hospital, Dubai. Very important reminder there to be on the ball when it comes to these sorts of things. Go and see your doctors. Check it out after that research that male cancers are on the rise.